Delanor.
Hello, I'm Delanor Manson. I'm the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. I'm glad to be with you guys tonight.
I always feel like since we've got doctor in front of the doctors, we need to come up with something in front of the nurses, just like as a courtesy title.
I agree.
What can it be? Make one up, Delanor, and we'll just use it.
Nurse Manson works for me.
Nurse Manson, I got that. All right, that's who you are from this point forward. I love it. So you guys, if you would just start out with one really important thing that I think a lot of people are asking, and Dr. Hartledge, you are the data tech wizard. So are we near or have we reached a plateau in Omicron numbers in Louisville?
Great question, Tara. I am the COVID data lady. So the Omicron wave has been, the numbers have been enormous compared to anything that we've seen in the past. Over the last 7 days, we logged over 14,000 new cases, which is huge. But the week before, it was over 16,000. So I do believe that we have plateaued or crested the wave, at least in terms of case counts. Traditionally, we'll see a very quick rise and then sort of a longer tail as we come back toward the baseline. So we're still in for collecting some more cases, and we still expect to see some rise in the hospitalization numbers, things like that, which are themselves at record high numbers. I believe 498 today, really closing in on 500.
Dear Lord. And as far as, the whole concept of hospitalization and death, we have shown time and time again, and it's been talked about time and time again, that being vaccinated and boosted reduces your chances of either of those things happening. So just percentage-wise, how many of the people who are dying, who are seriously ill in the hospital and having to be on ventilators and so forth, are those who have received the vaccinations and the booster and those who have not?
So across the board, you'll see about 85% or so of people who get infected or wind up hospitalized are unvaccinated. So about 15% of hospitalizations are seen in folks who have had some vaccination. And the more doses you've had, the lower your likelihood. So you have a significant reduction of your odds of getting hospitalized if you've had your 2-dose series. And then if you add the booster on top of that, it adds another significant reduction in risk. We're not seeing any significant number of boosted folks needing to be hospitalized. Dr. Burns, is that consistent with what you're seeing in the patients?
Yeah, pretty much so. Those patients who are, as you mentioned, fully vaccinated and boosted are less likely to be hospitalized, let alone to actually have a lot of severe symptoms. So severe hospitalization and death, we're not seeing that amongst the fully vaccinated boosted patients. That's correct.
And that is no indictment, especially on my part, of people who have chosen not to get vaccinated, but is certainly an encouragement to do so because we care about you and we would very much like to see you live for your children and your grandchildren. Dr. Burns, let's follow up with this. What's coming up behind it? What do we know about upcoming variants, and why should we be concerned that this virus keeps mutating?
Well, I've said on numerous occasions that as long as we have people who are unvaccinated, that gives the virus an opportunity not only to replicate, but during this replication, it mutates. And it's going to mutate because that's what viruses do to survive. What's upcoming? Well, it's hard to say. There's a couple of different pathways that we can go. Now, right now, as Dr. Hartledge pointed out, looks like we're beginning to come on the downslope of this. And if you look nationwide, particularly in the East Coast and the Midwest, those numbers are coming down as well. And if you think back, those were the areas that were initially affected first, like the Northeast, like New York especially. Those numbers are starting to come down. Down south, I think they're still going up. I don't think they've plateaued yet. And same thing with the West. But the best case scenario is that we all get through this period. We all get on the downside of this and get back hopefully to numbers that we were toward the beginning of the summer. Okay, that's one possible scenario. The other possible scenario, unfortunately, which is what this virus has done in the past, is there has been another variant that's come along and that has become much more transmissible and much more evasive when it comes to the protections of the vaccines, and it's made it harder all the way around. So unfortunately, that's another scenario that can happen. Right now, we really don't know which way it's going to go. We're all being optimistic and hoping that going on the downside this time, we can keep the numbers down and get into the numbers where, let's say, like you have for common colds, flu, those types of respiratory infections. If we can get the numbers down in those particular areas, it might be a little more livable.
Good to know. Delanor, we talk about vaxes and we talk about tests, and those are both critically important component parts to the battle that we are waging against this pandemic and against this virus. And we have a number of testing sites in the city, which I'm going to ask Kathy to talk about in a minute, but the amazing nurses of the Kentucky Nurses Association are testing frequently across the city. And what I'd like to know is, first of all, talk about the importance of testing and then how we can access the dates and the times and the locations of these specific KNA testing sites, which are in little spots like, La Casita and the YMCA Safe Place. Where are those publicized so that people can hopefully take advantage of the opportunities?
First, I'd like to say that testing is really important, especially if you've been exposed or you are symptomatic. And those little unknown places are actually on the health department website. They're all there. And anyone can go to the health department website and find out where we're going to be testing. There are a lot of other partners with the health department that are doing testing in addition to the Kentucky Nurses Association. I would say that most of our testing sites are really with the homeless and the disadvantaged. And so, but we will take anybody.
Well, a lot of our houseless folks are watching these live streams and actually tune in to a lot of the stuff that we do. So it's great to be able to pass that along to them. Thank you.
Well, I just want to say that if anybody sees that we're testing and we're near where they are, they can come. We don't turn anyone away, not one person.
That's fantastic. I appreciate that. I would like very much to talk more about kids. This was touched upon this morning during the absolutely wonderful hour that you guys had with the press conference this morning that was live streamed. I'm also publicizing the COVID hotline on the bottom of my screen so that people can call for help and understand what it is. But before we get into the kids, Kathy, just quickly talk to us a little bit about the testing sites. There are some limitations right now because of the extremely cold weather. There are difficulties staffing it because the testers are getting COVID. And it's also going to be 11 degrees at least tonight. And it's going to be very cold to be in outdoor testing sites tomorrow. The city doesn't control those testing sites, right? That's all independent contractors.
You are right, Tara. Thank you. We definitely work and we reach out to the testing providers, many testing providers, especially to ask them to partner with us to put testing sites in areas of the city where we've seen higher rates of COVID, maybe there's lower vaccination rates, and just to make testing more available to people. But, these testing providers, gosh, we have to appreciate so much that they have volunteers and staff standing out in the cold or the rain all day, and they are, doing the tests. But right now, you're right, they are struggling because not only are they like many other businesses and have employees who are out sick or having to quarantine or isolate, but also this cold weather is not really conducive to collecting the specimens. And I think Blue Water was sharing with us that some of their equipment or tubes or solutions were freezing. So please have grace and patience with them. My recommendation would be, we have a list of the testing providers on our website, and I put the link in your chat, Tara, in case you want to share it. But we have links to their websites, and they will update their websites. For instance, I believe tomorrow Churchill Downs is only going to be open from 1 to 5, as is the testing center at Southeast Christian Church.
Yep.
So just check their websites, maybe give a call ahead of time just to see if they will be operating. And, it's still important to get tested. Just have a little patience right now with what's going on.
Right. And if you guys want to go to the LouisvilleKY.gov /government/Louisville-COVID-19-resource-center/COVID-19 testing. I'm going to just tell you, go to LouisvilleKY.gov, COVID resources, you will find it, and that's what's really important.
Tara, I just want to add one thing, and that is that the KNA is not a contractor with the health department. We are a partner, and we work with them. So we're not part of that contractor team.
Right.
We're
you
part of
primarily indoor locations too. Is that right, Delanor?
Yes, at this time. The last time we did an outdoor drive-through was when we were just starting, and we only had PCRs at that time. We did them at Hope Wellness, and I think that was the very first one we did, and it was like 150 PCRs that we did. Hopefully we will never have to do 150 PCRs again.
Yeah, that's amazing. So let's go ahead and talk about kids. And I know that a lot of you guys are parents. Dr. Moyer's got 4 kids. I mean, she's not here tonight, but Dr. Hartledge, you certainly have an extraordinary child. She was, I think, the first one to get vaccinated in the city when the little guys got to come in and get vaccinated. So anyone who wants to take it, but let's start with Dr. Hartledge. Let's talk about kids. Babies to 5-year-olds still cannot be vaccinated. So one of our greatest concerns is protecting them. And I remember 2 years ago when people were saying, well, if it was the kids that were being affected instead of the old people, we'd all be going out and, buying masks and protecting the children. But are we doing that right now? I mean, lots of parents are missing work due to shutdowns and quarantines of daycares and so forth. What are we going to do until that baby vax comes up on the horizon?
That is such a great question. And we know that these things place an undue burden on lower income families.
Yep.
And they have taken a lot of women out of the workplace. There's lots of literature to support the workforce reduction associated with parenting in a pandemic. And Dr. Moyer and I are certainly right there with the rest of you. The last 2 weeks, all of our kids are at JCPS schools. So the last 2 weeks we were working from home and trying to manage NTI at the same time. So I guess my first point would be that I absolutely feel the pain on that one. When Camille, my kindergartner, was among the first kids to get vaccinated when her age group was opened up in November. And I was telling someone recently that we have a kind of a group of some of our female physicians in town, and that have social events and book club and things like that. And it was like the first time we had all seen each other in person in a long time, because all the doctor moms showed up on the first day to get their kids vaccinated. So I think that is like really the strongest statement in favor of vaccinating kids that I can make, is to say that I believe in it and chose that for my own child, and that many of our other physicians are doing it as well. I'm super frustrated that the FDA has requested extra data in the next age group. So that 2 to 5 group is the next one. And, I absolutely want to see them put the safest, most efficacious product out on the market, but we had hopes for a quicker timeline, and I think it's going to be a little bit longer. So all those things you mentioned about daycares, and as Dr. Moyer outlined this morning, that daycares and early childhood are continuing to have to do some of the more stringent measures as far as quarantine and isolation, because those kids are not vaccinated yet. They can't be vaccinated yet. And many of them at the sub 2-year-old can't wear a mask yet. So it's a tough spot. And I'm right there in it with the rest of you. So I was so excited when we got to go live with the kids 5 to 11 so that my daughter could get hers. So
tell us why you don't want to mask kids under 2.
It's mostly just an issue of compliance, just that they can't do it effectively. Some people have suggested that there might be a choking hazard if the mask came down and was like around their neck. And it's just harder for a kid that age to manage it. effectively. So it's hard to do below H2. But I mean, like I said, my kindergartner wears hers all the time, and the kids at school are able to manage it. So,
yeah, that's a tough one. Dr. Burns, when you have patients, talk to us about the patients that you actually see in your office. Okay.
Okay. Oh, I was just going to add on to what Dr. Harlage was talking about.
Sure. Go ahead.
As far as the kids go, the best you can do is try to make sure the people around them who are eligible to be vaccinated, that they are vaccinated. And that way that helps protect them. And then hopefully, as Dr. Harlage indicated, that, we can get more studies, the more information and the requirements, everything we need, to make a final decision on the dosage for the kids under the age of 5.
Yeah, very important. So talk to us about the patients that you see coming into your office, because there's a crisis of major proportions across the board. Hospitals are overwhelmed, immediate care centers are overwhelmed, doctors' offices are overwhelmed, and people are scrambling, which is why it's so important what the Kentucky Nurses Association is doing particularly, and why these new testing sites are available. And I know you're opening a couple up that we'll talk about in a minute, Kathy. But it's hard to get in just about anywhere. So talk to us about the patients that you're seeing in the office. What level of sickness are you seeing?
Well, it appears now that the level of illness that they're experiencing is actually does not appear to be as severe as it initially was in the beginning of the pandemic and around the time right before the vaccines rolled out. So in that sense, the severity is somewhat diminished. And I'm talking primarily about the people who are vaccinated. Okay. Those who are unvaccinated, unfortunately, nothing has really changed for them. Usually when they come in, they're usually severely ill. They have to be hospitalized. And unfortunately, some of those patients that I've had have died. And again, these are amongst the ones who are unvaccinated. Now, the major problem that we've had that hopefully will be rectified soon is that a lot of people come in wanting to be tested. They can't get in, to their primary care office. They'll come to our offices, or they'll even go to the emergency room to get tested. Now, hopefully, with the mailings of the at-home tests that the government has applied or in the process of doing, they'll be able to get those tests sent out to people who request them, and they'll be able to be tested that way. Of course, we tell everybody anyway that if you're just coming in to be tested, make sure that if you're feeling ill that you should be isolated or you've been exposed. Definitely at least quarantine until we get an official result. But by and large, the majority of people that we're seeing now are those who really want to be tested, not so much that are those that are severely ill, unless unfortunately they're unvaccinated.
Okay, so let's pop back to Dr. Hartlage for a second with a question I asked this morning on the presser. And that is, I've been doing this for a while now. I've been testing every week for 2 years. I drill that thing all the way back to the back side of my brain, right here. I have a little power drill that I use to insert the swab into my sinus cavities. So, and not everybody knows how to do it. And unfortunately, you really have to get it up there high in the sinus cavity to be able to get a good swab and then swap it around 5 times. Sometimes they do one side. At Churchill Downs, I noticed the guy who's tested me the last 2 weeks only does it on one side, but that's where I got positive. The thing that concerned me is that these particular tests, the quick views that I had several of, I was testing after I got my positive from the PCR, and I was getting negative home tests. So talk a little bit about the types of home tests that are most rapidly and accurately picking up the Omicron particularly, and then what you told me that you think maybe I got. Patient 0.
I'm giving Tara the crown to wear. So
you have no idea how happy that makes me.
We have. You're absolutely right that the PCR is the gold standard, and we don't doubt those results, right? So the way that those samples are collected and run in the lab, we believe that regardless of what variant we're talking about, The vast majority of cases right now are Omicron, but we do still have some Delta out there floating around and potentially others. So the rapid tests, the home tests, have proven to be somewhat less sensitive for the Omicron variant. And what that means is if you get a positive, you can absolutely believe that it's a true positive. Right. But if you get a negative, like what you experienced, it may be a false negative. And in many cases, that's a function of like the time scale where, we used to say everybody get tested on day 2 to 3 after exposure. Now we're saying more like 3 to 5 because people were not showing up positive as early. So in many cases, a quality sample later on does wind up turning positive sort of down the line. I was speculating this morning that we're getting asked about the BA2 subvariant, which I told Kathy this morning is sort of like Omicron's angry little stepsister. It's a subvariant of Omicron, but it's a little bit different, has some additional mutations in it. And we'll skip the technical jargon, but in essence, the flag that Omicron has on a test is absent from the BA2 subvariant. And so it is not always picked up on tests, and in particular, the rapid tests. We do know that we have seen the BA2 subvariant in our wastewater through full sequencing. So we do know that it at least has been here on the ground, and it is certainly possible that you may have had that particular flavor of Omicron and that the rapid test just couldn't pick it up.
Yummy. Well, and I did have some really weird symptoms too. I mean, I started out with a UTI, went straight to a sinus infection, and then just was extremely fatigued. And I've heard more anecdotal reports from people saying that UTIs seem to be associated with their COVID positive tests too. So who knows?
Wow.
Interesting.
Dr. Hartledge, you can have my brain when I die, okay? Just find out what's actually
I could use an expansion pack.
Sharon, anytime you want to hop in here, you can. I know you've probably got some questions on your platforms that I may not be seeing. So feel free to jump in anytime you're ready to, sir.
I mean, the biggest one for me is I've been hearing reports of people potentially being charged for tests or vaccinations at this point.
Wow.
So if anyone is being charged for either, what would you recommend?
Hey, can I jump in on that one?
Yeah.
So we, definitely we have several testing providers that are providing the tests free of charge. And so again, that would be Blue Water Labs site at Churchill Downs or Southeast Christian Church. We just recently put 2 new sites with free testing, one at St. Stephen's Church, one at Shively City Hall. So yes, they will ask you if you have insurance, and if you have an insurance card, they will try to collect at least an administrator fee from your insurance company, but there should be no out-of-pocket costs for you. But on our website, there are a few where if they've told us that they will charge some sort of a fee for testing, we've noted that. But vaccines are being provided free by the federal government, and there should be no charge for anyone to get a COVID vaccine. And please, Dr. Hartledge, correct me if I've said anything wrong, but a COVID vaccine, first, second dose, booster should be free.
Yeah, I'll let Delanor collect some out there in the field, so I'll let her weigh in, but we do typically collect the information if it's available, if you have an insurance card, but you're not going to get anything from us in the mail for a bill.
That's correct. And I'm also hearing from some of the other labs that they do collect the insurance company information so that they can bill the insurance, but not to bill the individual who's coming for the test or the vaccine. And so, I mean, I think it's okay to bill the insurance company, but, people who need tests and people who need vaccines, then they need to find clinics that we're running or clinics that are being sponsored and supported by the health department so that they don't have that inconvenience.
Yeah, because if you do go into one of the mini clinics of, one of the great major chain stores, the drug stores, the grocery stores, they definitely collect your insurance information. And sometimes they charge you for an assessment or a private visit in order to administer those tests or those vaccines. So you kind of get dunned for a little bit more. So, I mean, at this point, any port in a storm, but it is available to those, especially folks who are challenged right now to come up with money to pay for these things. And furthermore, if you go to a testing site and you don't think there's something right about it, for the love of heaven, let us know, because, Summer Dickerson's and my lives will forever be entwined from the guys that we literally, with Council President David James, drove out of Louisville, who were scamming people and charging them $300 to get COVID tests way back in the beginning, at the very beginning. And, they were reprehensible. They were not masked properly. They were using painters' overalls as their, outfits. They weren't changing their gloves. They were probably giving people COVID. And we chased them from site to site. And when they set up at Shorty's gas station down in the West End, we caught them. And we literally forced them to drive out of Louisville. And James followed them halfway to Memphis, Indiana, to make sure they didn't come back. So, that went viral on YouTube and every place else. And they had just been here the year before doing DNA testing in primarily West End communities and scamming people to get their credit cards, to get their social security numbers, to get whatever. So there are opportunistic people who will take advantage of just about any situation, especially when there's a crisis involved. So just if you have any suspicions, if you have any questions, please report it to the health department, let one of us know, and we will certainly investigate that. Jared, did you have another question?
Yeah, with students being, back in in-person schooling, I know that there was a lot of concerns with NTI, just with parents not having appropriate resources to get their kids resources for NTI. But with them being back in school, for the parents that are concerned, what are the best ways for the children to protecting themselves while being, in school?
Well, I'm going to start with, if they're over 5 years old, they need to get vaccinated. Let's just start there. And then they should wear a mask if they're indoors, and they need to wear a quality mask. We have, for the last couple of weeks, been encouraging people to ditch their cloth mask unless that's all they have. And if they have a cloth mask, could they double up on that? But to wear a quality mask that will protect the wearer as well as the people who are in their environment. And now that masks are free, and there should be at Walgreens and different areas, then I think, getting a supply of those N95 masks and wearing them anytime that you're indoors. And if you're in close proximity to other people and you're outdoors, wear a mask. I think that will, and making sure that you can social distance when you can, and you're washing your hands. I don't know many other mitigating circumstances that can help deter this pandemic than those.
Back to the basics.
A lot about the N95 masks. Where can people get N95 masks?
Well, I know that they've been mailed from the federal government, and many of the drugstores and like Walgreens and CVS are getting them. You can purchase them, of course, on Amazon. They're not cheap, but there are some ways to preserve your mask, and making sure that if your mask gets wet or it has makeup in it, then you throw it away. If it's wet, you don't wear it again. If it's dirty, you don't wear it again. So those kinds of things are pretty important for you to keep in mind.
I've been cleaning mine with like Lysol and alcohol and. Oh,
stop. Just stop. I'm just going to say, just stop.
I actually got a pack of 10 N95s for $1.10 a piece. So
can I just say, just drink the Clorox.
Yeah.
Don't worry about the mask. Drink the Clorox, and I get the black dress, right?
Yeah.
For the Zoom.
Inject it into my butt. No. Okay, yeah. Go ahead.
I'll just say that I think our friends over at JCPS in particular have really done an amazing job in what is an almost impossible situation to manage the number of kids and staff that they have, and the, transportation needs and education, of course, but accessory activities and feeding and all kinds of things. So they are a logistically enormous and complex beast. And I think that they have done a good job dealing with the hand that they've been dealt. One thing for little kids in particular is when we talk about masks, to make sure that it's a well-fitting mask. Little ones, it can be harder to find those particular masks that fit, especially things other than cloth masks. So as far as I know, the retail pharmacies are going to be sites for N95 distribution. That announcement was just made today, I think, the specifics. So I don't know that they're out there individually yet. But when I send my kiddo to school, she is vaccinated, and I send her to school in a mask. They do hand sanitizer on their way in the door every morning. And I always send her with extra masks so that she can change it throughout the day, because she will take it off on the playground and leave it behind, or it will get wet or whatever. So she'll change hers throughout the day, and we sort of keep them in a rotating basis that way.
We've been told by you guys that surgical masks are the second best to the N95 masks, and doubling those up is also requested if possible. If you can't get an N95, or wearing a surgical mask or an N95 under a cloth mask. But that quality mask should be the closest thing to your face, and then decorative stuff goes on top. Jared?
I just want to
the only other thing I was going to add to what Dr. Harlich and the other mentioned is to make sure also that the children, and this is more on the actual schools or buildings or administration, make sure you're in an area where there's good airflow, good ventilation in the area as well too. That's going to be important. In addition to what I said earlier, having as many vaccinated people around the children. And it's like Dale said, if they're eligible to be vaccinated, they should.
I want to add one more thing on the mask.
Go ahead.
You can never go past mask too fast. Make sure that they wear the mask over their nose. It is really important.
I knew you were going to say that.
Of course, you know how I am about that nose.
Instead of a chin bra?
Yeah.
I just want to note that someone commented and said that home improvement facilities, you can get N95s. I forgot they're used in construction oftentimes as well. So Lowe's, Home Depot, things like that, you can often find N95.
Yeah, that's a great point. If you buy one of the ones for painters and it has an expiratory valve on it, either don't get that one or put a cloth over it. The valve ones are less good to be using than the ones without the valves.
I would just also say, I think and free N95 masks are being rolled out, not just to pharmacies, but it also looks like large grocery chains. I think Meijer may be starting to get them. Kroger is supposed to get them. So hopefully we will all be able to pick them up at our local pharmacy or grocery chain here very soon.
That sounds great.
Jared, did you have one more thought, or did you finish?
No, those were the two big ones that I had.
Perfect. Okay. Let's go back to pregnant moms, to whomever would like to address this. There has been so much misinformation scattered about on that horrendous thing that serves us so well and yet causes us so many problems, the internet. And one of the things that has been going around that I've heard anecdotally over and over again is the fact that there's some fear that a vaccine is going to harm a child in utero, when in fact, what you guys have explained over and over again, and what is commonly becoming known, is that protecting your child, your unborn child, by vaccinating yourself is one of the most important things that you can do. And it doesn't matter whether you're 10 weeks pregnant or 32 weeks pregnant. So let's talk a bit about that, whoever wants to start.
I'll go first. So one of the really interesting things about COVID has been watching science happen in real time. So
Yes.
we have at many points in this pandemic had to honestly say, you're asking a good question and I don't know the answer. But the scientists and researchers have really done an excellent job of performing that research so that we can learn those answers. And this talk about fertility impacts and impacts on pregnant women is one of those things that, 2 years ago when we started this, there were many questions about it, and people felt pretty comfortable saying, I don't think that that's a problem. I think that it's probably fine, but we didn't have the data to necessarily say it for sure. So just this week, there was a great study come out of Boston University called the PRESTO study, because you have to have a snazzy acronym in your study to get it published these days. But they tracked a whole bunch of people that were either infected or vaccinated, and they looked at their fertility. So we had women who were vaccinated, women who were infected. We had men who were infected and men who had been vaccinated. And they all had, 3 of those groups had fertility rates, conception rates that were very similar to, it's about 18%. So it's a very similar to the rest of the cohort. So just regular average Joes, right? Just the run-of-the-mill population. The only group with a decrease in their fertility was actually the males, the men who had recently been infected. That's not super surprising because we know that the testicles can be impacted by the virus directly. And so probably there's an issue with sperm. It seems like that's a relatively short-term issue over a few months, and that people do go back to normal. But COVID itself can reduce male fertility. For women, it doesn't seem to make a whole lot of impact either way. And then when we talk about the pregnant woman getting the vaccine during pregnancy, pregnant women, I'll let Dr. Burns speak about this, but pregnant women are at high risk for severe infection. When a pregnant mama gets sick, she gets real sick. And that vaccine can help protect her, and the baby can actually be born with antibodies, which I just think is so cool. The baby can be born, and if you check their antibody levels, they have antibodies to COVID at birth. And if you breastfeed, you can continue to transfer some of those for a while as well. So our little kiddos can't get vaccinated yet, but moms can provide some of that protection by getting vaccinated during or boosted during their pregnancy.
I don't want to sound like too much of a smart aleck, but I think we've just found a major reason for men to want to get vaccinated. It can affect the testicles if you get COVID, but it will not happen if you get vaccinated. Dr. Burns, you can comment if you wish.
I was going to say, Delanor knows I've talked about this in the past as well, too. Yeah, the men are worried about the vaccine making them infertile. It's not the vaccine, it's the actual COVID itself. And as Dr. Harledge was alluding to, yes, pregnant women, that is a very high risk factor for a bad outcome for those who are pregnant and get COVID. So again, vaccination, it's been recommended by the American College of Gynecology. They understand, everybody understands that it's imperative for women to be vaccinated. And also, as the point was already made, those antibodies that are made by the mother do cross the placenta and do protect the child. So all the more reason for pregnant women to get vaccinated. And with the low sperm counts, for men worried about infertility, again, all the more reason for men to get vaccinated.
I want to add 2 things to that. Dr. Burns and I have done a number of listening sessions together. And one of them was with a group of teenagers. And I remember Dr. Burns trying to explain to them that, if you get the vaccine, chances are that it will not impact your fertility. However, if you don't get it, you might not get to have children. And I watched the faces of these kids, and it was like, what?
Wow.
What? No kids? And, I don't know if you were able to see the facial expressions, but I was through the eyes. You really hit the mark on that one. And the second thing that I want to mention is that we vaccinated a young mother who was very reluctant to get a vaccine. She had 2 other children, and she was pregnant. And her GYN told her not to get the vaccine. Again, like Dr. Harledge said, there was not a lot of data to support either way, one way or the other. But I did talk to her about the safety for her baby, and that the great possibility that the antibodies would cross the placenta. So when she had her baby, she called me and she said, "My baby has antibodies."
Wow.
Thank you so much. You're talking about making a person's day.
Yes.
That made my day.
It absolutely does. And it's amazing when you stop to think about, Dr. Hartledge just spoke such true words when she said, it's amazing to watch science actually living, breathing, changing. And that's why it frustrates me so much when people say, well, 2 years ago, they told us not to wear surgical masks because we were, using up all the ones that the doctors needed. And now they're telling us to wear. Well, that was 2 years ago. This is changing daily. And there is new guidance that's important to talk about. So let's discuss some of the new guidance that Dr. Moyer shared today. And Dr. Hartledge, if you want to take that on, you're welcome to, whoever wants to do it. But there have been just some changes, or some clarifications, I should say, in the guidance for quarantine and isolation.
Yeah, we continue to struggle as a society to find a balance between protecting folks and limiting spread of disease, and particularly protecting our vulnerable populations, and finding that balance between those public health measures and being able to, I don't even know what get back to normal really means anymore, but, to be able to have businesses open and schools open and things like that. So to be clear, I think we all agree that having kids in school and the economy functioning is like best case scenario. And so the new CDC guidance sort of tries to assist in making that happen. And really what they did is they cut the 10-day mandatory down to 5 days for quarantine or isolation. Importantly, there's a caveat there, which is that if you're going to leave your home on day 5, that you have to wear a high quality, well-fitting mask for at least 5 more days. So the 5-day thing is not a get out of jail free card. If you're going to return to your place of business or to your school or whatever, that you need to really step up your masking. And many people even suggest masking at home if you have people who are not co-infected with you. So as Dr. Moyer mentioned this morning on our briefing, the daycares in particular are struggling because they can't use that guidance for the little bitty kids because they're not vaccinated yet. And then they also have some difficulties with mask wearing. So we are going to, I think, continue to see some closures and things in daycares, but the goal from the CDC's newest guidance is to try and keep other services up and functioning as much as possible. No one wants to return to a lockdown. Our kids were out for about 2 weeks and they're taking it day by day. So I share the rest of the parents' anxiety waiting for that text message every afternoon to see if the kids are going to school tomorrow. But being able to balance those competing needs is a really important step for us.
Well, I can say for one that Nurse Manson made me stay in for 10 days.
There is a reason for that.
Tell me why.
Well, first of all, you had exhibited symptoms, and your symptoms were not resolving as quickly as you had told me. It was interesting because I would talk to you and you say, "Oh yeah, I feel fine." And then I talk to you a little bit longer and you say, "Oh man, but I'm so tired, and I can't really, I can't get my breath as much as I like." And so as we would talk, you would tell me more of your symptoms. It was like, you need to stay in. So I think that you couldn't go wrong by staying in for 10 days.
Right.
You could go wrong by going out in 5 and still being infectious. So I think the 10 days for you was the right call.
It absolutely was. Thank you, Nurse Manson. Dr. Burns, I'm going to touch on you for just a second, if you wouldn't mind, because, one of the things that I think a lot of people are really, really confused about right now is why, when you get the vaccine, do you still have the opportunity to catch COVID? Mm-hmm. And just explain to us what that mechanic is without getting too technical, because I know you have a great brain for this kind of thing, but tell us why you can still get sick when you are vaccinated.
Well, you have to understand, first of all, number one, the vaccines are not 100%.
Right.
So, we do have the potential for what we call the breakthrough infections that can occur. Secondly, if you look at the variants that are out there, and we'll just start with Omicron, because of the mutations that have taken place from the wild type through the Alpha, Beta, Delta, now Omicron, the virus, remember I had talked earlier about how it mutates, and it does that because it's trying to survive and it's trying to work its way around the protections of the vaccine.
Right.
So what happens is you find yourself, as these variants come along, it takes a smaller amount of the virus actually that can actually be more infective. Okay, I'm trying to just make it as plain as possible. What's really going on is when they talk about the variants being highly transmissible, they're basically talking about how much viral load does it take for a person to get infected. And as these variants go along, it takes a smaller amount of the viral load to make a person infected. Okay, so even if you're vaccinated, there's still the potential that you can get infected. The good news, again, this is about the vaccines, and particularly those who are fully vaccinated and boosted. Okay, those people are less likely to have serious illness, be hospitalized, or to die. And again, that's the importance of vaccination. That's where vaccination will help. Again, no vaccines are 100%. Yes, you can still get infected, but you have a better outcome if you're vaccinated and boosted, or if you're just vaccinated.
Talk to us
More
about
so than being unvaccinated.
Okay, talk to us about fourth shots. For those of us who have immunocompromised, as I do, for those of us who've been, boosted for 5 months, because I was in August, talk to us about fourth shots.
Well, let's see. Actually, I kind of use a little different terminology because it helps me keep straight in my head. Those people who are immunosuppressed, okay, they are actually going to get they after, let's say, for example, they get an mRNA vaccine. Okay, they get their first shot, and then 3 or 4 weeks later, they get the second shot. Okay, those people who are immunocompromised for whatever reason, whether they have cancer, severe kidney disease, or something that's preventing them from making or having a substantial response to the vaccines, that is, making lower amounts of antibody. Those are the people. They are actually it's actually been recommended and approved that they have a third shot. Okay, and that shot is going to be a full dose of whatever vaccine they'd had prior to that. Okay. When you talk about fourth shots or boosters in this context, then those usually are given months later, and we've narrowed it down to like 5 months after their last shot. Okay, then that would be a fourth shot for them. For everyone else who has a normal antibody response, then it would actually be just a booster, which would actually be a smaller dose than what they got for their original mRNA vaccine. So again, I'm not trying to confuse anybody, but just know that if you're immunocompromised, okay, and you get an mRNA vaccine, you should get a third shot, which should be a regular full dose of whatever those vaccines you had previously. And then a booster shot is going to be the smaller dose of those vaccines that you had previously.
Tara, I like to liken it to a little army. Dose one, we've got, I can't help it, Mark.
I know, I love it.
The dose one is you get the army together and you're training them up. Dose two, you add some more, people, more men, women to the army. And if your immune system is not good, then sometimes they sit down on the job. So you need to have another grouping of Army people to come to boost that immune system. And so they get up and they start doing those jumping jacks. And then in 5 months, they're getting kind of tired and man, gosh, I think I want to go out and have, go to parties and stuff like that. That's when they bring on the boosters. And the boosters basically said, okay, there is no sitting down on this job. Everybody get up, let's get started, no more partying. We have to get ready because the virus is coming. So I like to liken it to, getting your army ready to fight the virus because it's coming.
This is
When Delanor says get up, let's go. When Delanor says get up, let's go, everybody has to listen.
Dr. Hartledge, let me come back to you for a second, because what I'm curious about is when is the world going to catch up with, the concept that fully vaccinated may not mean just getting your first 2 shots?
So here, that's another interesting question, and it's something that is the subject of a lot of research right now. So if you remember, Israel has been really ahead of the curve on the vaccine actions. Because of the size of their country and their national infrastructure, they were able to deploy very quickly across basically their whole population. And then they were the first country to take the step to get boosters. Now they are preparing to start doing another round of boosters, which would be a 4th shot for most people in the standard sequence. That is not something that's on the table yet here in the States, but I don't think any of us would be surprised to see that eventually. There are some other vaccine products in the pipeline, things that are aimed at different parts of the COVID virus or that are paired with flu vaccines and some other things. So maybe by the time we take that step, we'll have something different to talk about. But, we are going to continue to develop new variants until we have global vaccine equity. All that it takes is one person really to develop, to be that petri dish to make a new variant. In fact, there's some pretty good evidence that the Omicron variant developed in a single person because of the way the mutations piled up. So, we're currently in a situation where we have billions of people across the globe that have been vaccinated. And in our high-income countries, there are mostly these very effective mRNA vaccines. There are some less efficacious vaccines being deployed in some other places in Southeast Asia and South America. And then there's a wide swath of the world that really has virtually no access to vaccination at this point. So until the high-income countries decide to make it a priority, I would like to say that in the end, when COVID becomes endemic, that it will be something akin to the flu, where you may need a specific booster every year or something similar. But until the high-income nations make global vaccine equity a priority, we're going to continue to develop new variants. It's really easy to see COVID as a hyper-local problem. What's happening in your kid's school, what's happening in your zip code. And we do track all those things, but it's also a global problem. And so, Governor Beshear used to say, we will get through this together. And I think until we, as a global society, take that step, that it's going to continue to rear its head.
Christy Young just asked, if you initially had the J&J, then boosted with Moderna, should you be taking a second booster immunocompromised or not?
There's no current recommendation for a second booster right now. So if you got the one J&J shot and then at least 2 months later, you got an mRNA booster, as far as the current guidance goes, that's complete.
Okay, important. Kathy, I want to ask you to wrap up because it's almost 9 o'clock, and I know most of you have been going since 4 or 5 o'clock this morning, and we appreciate you accommodating the late hour for the people who are, hanging out at night wanting to be educated and informed, and thank to all of you. Kathy, just kind of wrap up with sites, locations, times to get testing, availability of, masks and vaccines and so forth, everything that you just want to throw out that the health department wants us to know, you can go for it.
Well, I think first and foremost, we really want people to know the helpline. So thank you, Tara, for continuing to share the COVID helpline, which is that 502-912-8598, because you can really call them for anything. If you need to find a testing location, need to find a vaccination location, you need a copy of your vaccination card, you have tested positive and you are really not sure what your next step should be. If you're not sure about how long you should quarantine or isolate, maybe you live in a multi-generational household, you're positive, you have symptoms, and you need a safe place to isolate away from your family. We can help with that as well. Or maybe you are at home alone, you're sick, you need some groceries, or you need some medications or something. You can call us and we can help with all of that.
So dog food.
You might need some pet food. We have delivered pet food as well. If someone is home and they have just them and their pets and that's what they need, we want to help people. We know it's hard. All of this is hard and we want to help. And just definitely, we have testing locations, vaccination locations. And I want to reiterate what I think you had even said earlier. If you see a testing site and it just doesn't look quite right, maybe they are asking, it's a drive-through site and they're asking you for money up front, or maybe you're noticing the staff is not wearing the appropriate PPE, mask and face shield. Maybe just it doesn't feel right, leave, don't go there. And would encourage people to, if you suspect a testing site is not operating correctly, you can call us, you can call the Kentucky Attorney General's office and file a complaint. So, I think those are really some key things that we want people to know. And I think one other thing that I will add is there are an awful lot of people out there who are contacting us because maybe at their workplace, they don't feel like things are being done as safely as they should. We've had some people call us and complain that I've tested positive in my employee and I have symptoms and my employee is telling me if I don't come to work, I'm not going to get paid. And that is really unfortunate. There are no Kentucky Healthy at Work restrictions anymore and guidelines, but we would hope that every business, every daycare, every school, anyone would really want to operate as safely as possible for their employees and for their customers as well. But if people feel like a workplace is in violation, they can call Kentucky OSHA and file a complaint. So
good. Thank you so much for that summary. Any last thoughts? Anybody else wants to kick in? Feel free. And then you can collapse and go to bed for the night. Good. Thank you, Dr. Burns, Dr. Hartledge, Nurse Manson. I'm not sure what we're going to call you, Kathy, but how about Queen of the Health Department?
Just call me.
Just call me.
Jared says as long as you call him for dinner, he's going to be fine. So thank you all. You got a final thought, Jared?
I just want to thank you all so much for your time and expertise, and I hope that we can do it again in a couple of weeks.
Sounds good.
Appreciate it. Thank you guys so much. Have a great night, everybody. Feel free to send questions and I'll get them answered for you. Good night.
Bye-bye.
Good job, you guys. Thank you.